morning and welcome to WRCO's Morning Show. I'm Joanne Krulotz in again for Phil Nee as he is out. And today we are going to visit with Evan Ewing, Public Health Specialist for Richland County. Good morning, Evan.
Morning, Joanne. Thanks for having me on. I appreciate it.
Most welcome. And I know you've been kind of doing this as a regular thing each month to keep the listeners updated on what's going on in the area. And we've got really quite a few things we want to talk about this morning.
Yeah, for sure. Really each season kind of brings with it some new public health concerns. You know, the winter is the kind of respiratory virus season. And then with the summer, more items like waterborne illnesses, tick-borne disease, animal bites, those kind of things tend to be more prevalent. So I thought that would be this would be a great time to kind of discuss prevention around those areas today.
Especially now that it is hot and people are out not just swimming in chlorinated pools that are kept up to date and tested, they're out and about and kayaking and everything else.
Yeah, those natural bodies of water can kind of pose some some issues as well that we'll talk about. So, yeah. All
right. Well, what do you want to start out with first? The animal bites? You know, kids are always, they see a strange dog and most of the time they're not afraid. They want to go up to them.
Yeah, my daughter included, yeah. Animal bites tend to be more prevalent around this time of year just because more people are outdoors with their animals. So specifically dogs tends to be a little bit busier for animal bites. As a listener, you might be kind of wondering, why is public health involved in animal bites? And we get involved because we're primarily responsible for rabies prevention. So if you're not familiar, rabies is a deadly virus that is spread to people from the saliva of infected animals. And it's almost always fatal once symptoms develop. So it is taken pretty serious. I think it's important to just inform the public in general of what that process looks like if your animal is involved in a bite. I think people are generally kind of unfamiliar, and hopefully it's not something that happens regularly with your pet, but I think people sometimes feel blindsided when law enforcement shows up at their door issuing an animal bite order. So there's a lot of different scenarios that we respond to, so it's kind of difficult to cover every possible scenario in this discussion, but a general example would be that, let's say I have a dog and we're out walking and my dog bites your hand and you seek medical treatment for that. The healthcare facilities are required to report that incident to law enforcement, and then law enforcement would contact the owner, which in this case would be me, just for this example, and they would issue me an animal bite order. And that order essentially lists out the Wisconsin state statute surrounding rabies prevention. And then the owner has to sign off on that, basically saying that they understand and will follow state statute. Law enforcement would then send public health a copy of that bite order, and then public health is responsible for enforcing state statute, which basically states that the owner is responsible for taking their animal to be examined by a vet 3 times over the course of 10 days to monitor for rabies. Their animal would also be required to quarantine for that 10-day time period. And I won't go into all the details of the state statute, but if your animal is up to date for its rabies vaccine, then you can quarantine your animal at home as opposed to a quarantine facility, which is not only more convenient, but will save you a lot of money too. So if you're listening right now, is your sign to check with your animal's vet and just make sure they're up to date for rabies, because you can be a really proactive owner, but sometimes, unfortunately, these scenarios happen, and you can do everything right and still have your animal involved in a bite.
Now, that's, we're talking about domesticated animals who have an owner, but if you are a person, out and about and you get bit by a wild animal, should they still come to you for?
Yeah, so likely you would seek medical treatment in that case, and with wild animals, that's where you would likely initiate the rabies vaccine. It's with those wild animals, like if you were bit by a raccoon, chances are it would be difficult to capture the raccoon that bit you. because if you do capture the animal, it can be euthanized and tested for rabies, but they have to test the brain matter, so the animal has to be euthanized to do that. So if you were bit by a raccoon, for example, and it ran away, then it would be recommended to initiate that rabies vaccine at that point, because there would be no way to determine if that animal had rabies or not.
And what is the steps in receiving the rabies vaccine?
It's a lot different than I think what it used to be. I think people associate it with the shots to the abdomen, and I think it's different now than that. I'm not sure off the top of my head the exact process, but I know that they will do a shot usually at the bite site immediately, and then they'll give the rabies vaccine, and then I believe they're separated out by 2-week increments over I think 3 shots, if I'm reporting that correctly. So it's a little bit of a process, but in those cases where we can't determine whether or not the animal has rabies, then that's where that rabies vaccine would come into play.
And there's no ill effects. I mean, if the animal didn't have rabies and you get the shots anyway,
and sometimes we'll recommend initiating the vaccine anyways, and then like if you were exposed to a bat, for example, and the state lab is testing the bat specimen for rabies, then it doesn't hurt if you got the shot initially and then they determine that it's negative, then you can just stop the series at that point.
So best thing to keep in mind, if you get bit, seek medical treatment. It's built into our process too to reach out to animal bite victims too. If you're bit by a dog or a domesticated animal, we reach out to them as well and provide that guidance too. And that's part of that process where getting those vet checks is giving that extra assurance that over that 10-day time period, your animal did not develop rabies. They were checked by a vet, and then usually they're given the rabies vaccine at the end of that 10 days if they're not up to date. So really important as an animal owner to be proactive and get your animals, keep them up to date with the rabies vaccine. Some other ways to prevent bites as an owner would be just to supervise your animals. Don't let them run at large. You mentioned children. That's another thing. Just making sure that kids aren't unattended around animals, especially like if you see a stray cat or a stray animal or an animal that's at large without an owner nearby, it's best not to approach them, even if they look really friendly. There's a lot of situations where that can happen as well. We're bit by a stray and then we're unable to locate the stray animal and we wouldn't know its vaccination status, those kind of things. So just being a proactive owner, vaccinating your animals for rabies, and then just don't be surprised if you hear from public health and law enforcement if your animal is involved in a bite. Well, we're kind of focusing on kids because it's summer and they're out and about and running around and going to the pool and the park and camp activities. The next thing, is keeping them safe and not having bites, but also preparing them for the school year with immunizations.
Yeah, definitely. We're getting to that point now. Unfortunately, where the summers, we can kind of, I would say we're about midway through the summer, and August will be here before you know it, and then it's time for those back to school vaccines and thinking about those fall and winter related respiratory viruses and vaccines like for flu, RSV, and COVID. Speaking of flu vaccines, I think every year there's some hesitancy regarding the flu shot. So I just wanted to, share some general information on the flu vaccine that might assist some of you listening if you have that hesitancy. Just want to preface this section too with the recommendation to just speak with your provider or doctor about any and all vaccines. If you have, questions about them specifically, you can speak with one of our registered nurses at Richland County Health and Human Services. But just in general, flu shots are safe. For over 50 years, millions of people have safely received the flu shot, and the CDC and the FDA monitor that vaccine safety really closely every year. They do save lives. I know some people, may dismiss the flu vaccine, but The CDC estimates that during the 2023-2024 flu season, nearly 10 million flu-related illnesses and nearly 8,000 deaths were prevented by flu vaccination. And they also prevent hospitalizations, which is important too, to sort of ease some of that burden that our health systems face in that time of year. So in that same time frame, 2023 to 24, the vaccine prevented 4.8 million medical visits and 120,000 hospitalizations. So very helpful and beneficial to sort of ease some of that burden for our health systems. And then the flu shot has minimal side effects, if any. They're mild usually and generally would go away on their own after a few days. It's very rare that an individual would experience severe side effects from a flu vaccine, but as always, it would be recommended for you to talk to your doctor before taking any vaccine. So that's just some general overview information of the flu vaccine.
Now, do the flu vaccines change each year related to what flu they feel is going to be going around?
I believe so, yes. So I'm not sure how that data is, like how they predict that, but you are correct to my understanding, yes.
So it's, I know some people have said, well, I had the flu vaccine and I still got sick. Well, it was probably a different strain of what you were vaccinated for. Is that the case?
Yeah, and I think, it can, even if you get the flu, it can make those symptoms, not quite as bad, or make them a little bit more manageable too in some cases. So, that's just kind of how vaccines work. Sometimes they don't fully prevent you from even getting it, but they can make those the symptoms that you feel and experience a little bit, not quite as bad.
What are some of the symptoms of the flu?
So this would be like your fever, body aches. You can have those respiratory symptoms as well, like stuffy nose, cough, those kind of things. I think people sometimes mistake like the stomach flu for the influenza, and stomach flu would be like your vomiting and diarrhea, those kind of things, which would probably be more something like norovirus versus influenza.
Do maybe some people think too that, I just have a cold, and so they're out spreading?
Yeah, no, for sure. Yeah, unfortunately, I think that can happen. I think the fever is kind of one of the differential symptoms between the two, between just a common cold and the flu. I would speculate too that like body aches and those kind of a little bit more severe, quote unquote severe symptoms would be associated with the flu.
Now, you stated, get vaccinated or get the vaccine. What is the best way to go about getting the vaccine?
Yeah, so if you have insurance and you can go to your provider and have that billed through your insurance, that's good as well. I did want to mention too, for anyone listening out there, we do have an immunization clinic at the Richland County Health and Human Services building on Thursday, July 24th from 10 a.m. to 4 p.m. So walk-ins are welcome, but we do encourage that people call in advance, and it helps us just prepare for your visit. We can look up your vaccine history in advance. It's not quite flu shot season, but if you have a child that's uninsured or underinsured, we may be able to provide some of their back-to-school vaccines if your child needs them. At Richland County Health and Human Services, we're considered a VFC program provider. So VFC stands for Vaccines for Children, which is a federally funded program in the U.S. that provides free vaccines to eligible children who might not otherwise be vaccinated due to cost. So it essentially ensures that all children, regardless of their ability to pay, have access to the recommended childhood vaccines. You might be wondering, what's the definition of underinsured or uninsured? So children ages 18 and younger can get vaccines for free or at a lower rate if they're enrolled or eligible for Medicaid, if they're an American Indian or Alaskan Native, if they don't have health insurance, or if their health insurance doesn't pay for all vaccines. So that would be VFC. Similarly, we have VFA vaccines as well, which stands for Vaccines for Adults, which adults would qualify for if they're uninsured or underinsured, Wisconsin adults ages 19 and older. And similarly, you would be uninsured if you don't have private health insurance, Medicaid, or Medicare. And then underinsured if you have insurance, but it does not cover certain vaccines, or if it has a fixed dollar cap for vaccines. So once that dollar amount's reached, then you could be eligible for VFA. In general, some of the vaccines that are available through VFA would be like hepatitis A and B, the human papillomavirus vaccine or HPV, COVID-19, flu, measles, mumps, and rubella or MMR, meningococcal, RSV for pregnant people, tetanus, diphtheria, and pertussis or Tdap, and then tetanus and diphtheria or TD. We can give tetanus boosters to people 65 and over, as well as other uninsured adults. And then we have varicella as well. We don't have the shingles vaccine, though, just as a heads up. So those are just in general vaccines that are available through VFA. I don't know our quantity or inventory off the top of my head, but that's just kind of a general list.
Now, you mentioned, it's not the season really right now for the influenza. What is the best time of year to get any vaccine?
I think September, I would say, would be when we would want to start thinking about those respiratory, those upper respiratory virus vaccines like RSV, COVID, and flu. Your provider may say as early as August, but I think September is usually when we're starting to get into that. We're beginning that respiratory season. People are going back to school, just spending more time indoors with other people. So I would say September is probably the time when you'd want to at least start thinking about that.
That's what I was wondering, if the clue is when you're going to be spending more time indoors with others.
Yep. I think we do most of our, I would say most of them, the vaccines we do occur probably, or at least for upper respiratory viruses, would occur from, September through, January at least.
Now, I've been reading about the COVID-19 vaccine again in the news, but it's still recommended to get that on an annual basis, isn't it? Like you do the flu shot?
I believe so, yeah. And we, from just talking with people kind of anecdotally, I think a lot of people get the flu and COVID vaccine at the same time. So your provider may offer that when you go in, if you go in the fall, and then, you could stay up to date for those.
Well, it sounds like, you got all kinds of things for people for the spending time outdoors and what to watch for, spending time indoors and how to protect yourself. It sounds like you're well-rounded in health.
Yeah.
I guess that's
for sure. Yeah. It's, that's the part of public health is prevention and trying to do those upstream interventions to prevent disease in the community. And, part of that is the vaccines. I think a lot of people think of public health in that way, but we respond to, when we get reported cases of enteric illnesses, tick-borne illnesses, those kind of things, we're involved with that too. And then, obviously animal bites is that upstream prevention of rabies. So, prevention is really one of the hallmarks of public health.
Does the public health keep track then, like if there's, measles is big in the news right now. If there were measles cases and that, do you keep track of those or?
Yeah, so we get reports from, I believe nationally about kind of where, what the status of that is in terms of case numbers and prevalence in the U.S. With the MMR, I mentioned that we can offer that vaccine through VFA. As of our last report in mid-June, about 2/3 of measles cases in the U.S. were those that are individuals who are 20 years or under 20 years old. And 95% of those cases are unvaccinated individuals or have an unknown vaccine status. And 12% of those cases have been hospitalized. And at that time, 3 deaths were reported. So I believe as of now, there have been no confirmed measles cases in Wisconsin this year. But a concern is the fact that Wisconsin has, in general, low MMR vaccine rates. So if if you know your family is going to travel internationally, you'd want to make sure that your family's up to date for the MMR vaccine. The general guidance states that 2 doses of the MMR vaccine are recommended by doctors as really the best way to protect against measles, mumps, and rubella. Children may get 2 doses of MMR-V, which is MMR and has varicella as well. And, if you're listening and kind of wondering about a measles booster vaccine, the general guidance would be that if you're born before 1957, you would already have been exposed to measles and have immunity. If you're born between 1957 and 1988, the answer is, maybe. You should have received 1 dose if you fall within that time frame. But if you fit into a high-risk group, like you work in healthcare, or you're a college student, or you're planning to travel internationally, then you should make sure that you've had 2 doses of MMR. Some of the vaccine that was used between 1963 and 1967 were inactive. So if you got an inactive dose, you would need a vaccine as well. So you would just want to check with your healthcare provider if you're in doubt on that. If you're born in or after 1989, then if you've received 2 doses, you don't need a booster. But if you only received 1 and you're school age, or you fit into one of those high-risk groups, like you work in healthcare or you're going to travel internationally, then you should make sure you've received a 2nd dose. Wanted to plug the Wisconsin Immunization Registry as well. This is a website. We call it WIR for short, WIR. But you can go on there and check your vaccine record if you've been vaccinated in Wisconsin. You can go in there. It'll ask for your name, believe date of birth, or social security number, and then you can see and have access to your whole vaccine record there as well. So we do get calls sometimes, people asking if we can access that for them, but if you just go on to WIR, WIR, or Wisconsin Immunization Registry, you can access your record there.
So it sounds like they know everything about us.
A little bit. Sometimes, like, for example, I lived in another state for a little while, so none of those vaccines I got there are in my record until they're, until I have my record transferred here through my healthcare provider, and then they could add them. Same goes with my daughter. She was born in a different state, so the vaccines she got there weren't in that registry prior to us moving, so.
Well, you've got some interesting things, and we have more to talk about. So we'll take a break and be back with more with Evan Ewing. And it looks like we're going to be talking about ticks.
Yeah, a little bit.
Back to our morning show on WRCO, and we're visiting today with Evan Ewing, public health specialist for Richland County, and we've been talking about a number of things. We've talked about animal bite prevention and immunizations, but as summer continues and people are out and about and not so much worried about public pools because they're monitored, but canoeing or kayaking down the Pine or going to Devil's Lake or any of those places, there's always a chance of waterborne illnesses, isn't there?
Yeah, it's definitely a time of year where everybody's out enjoying those outdoor recreation water options, which is awesome. I know we have some great options available to us here in Richland County, and unfortunately, this is also a time, when we're looking at communicable disease surveillance, where we see a slight uptick in those waterborne illnesses like Giardia and cryptosporidiosis. We just call it crypto for short. Giardia and crypto are waterborne enteric illnesses, and they can cause some pretty miserable symptoms like vomiting, diarrhea, stomach cramps, fever. And I would say most of these waterborne illnesses are contracted by swallowing contaminated water. So really, no matter what type of water you're swimming in, it would be recommended not to swallow the water, even in chlorinated pools and those type of facilities as well. With chlorinated and properly maintained pools, the chlorine doesn't instantaneously kill the germs, so it is important to shower before and after swimming. If you're changing a child's diaper at the pool, you want to make sure you wash your hands before going back in the pool. And you wouldn't want to swim in a pool if you notice like a visible scum line kind of on the edge of the water, or if the water was noticeably cloudy. When we consider natural bodies of water like rivers, lakes, ponds, those sort of settings, it's important to mention that the conditions of those bodies of water can change quite rapidly. So if you think of a river like the Pine River, after we get a lot of rainfall, there could be an increase in the presence of contaminants like animal feces or septic tank overflows, those kind of things. And, maybe way upstream on the Pine, there was, some farmland that was flooded and it went into the Pine, and there was, animal feces that, is in that water kind of running downstream to where we would be swimming at here. That's kind of the idea. So you really don't want to swim in those natural bodies of water after rainfall. If you notice things like discharge pipes, if you're at like a beach that you're swimming at, you would want to avoid swimming in that water as well. Personally, if you notice that you're experiencing any of those common symptoms of those recreational water illnesses like diarrhea or vomiting, definitely contact your medical provider. They may run a stool sample test, like a lab test of your stool, and that would help determine what enteric illness your body's fighting off. If that is confirmed as a positive enteric illness, then public health will likely reach out to you, and we'll try to determine maybe where you would have been exposed to those parasites. The exposure period for crypto and giardia is 2 weeks. So, for example, if you experience diarrhea or other symptoms of a water illness, you may have been exposed to those parasites 2 weeks ago. So, just want to mention too, if you have a private well and you suspect that you may have been infected from your well water, you can obtain a water test kit from Richland County Health and Human Services. The kit itself is free, but you would just have to pay for the actual tests at the state lab that are conducted. So there's a form that's kind of like an a la carte, and you can pick whatever tests you want to have done, and then you would send in that sample. If you are sending a sample in, just want to give a reminder to send those in on a Monday or Tuesday. If you're testing for bacteria, if you're testing for metals, they're not really time sensitive, but if you're testing for bacteria and it arrives to the state lab on the weekend, then those test results will likely be invalid because the bacteria is time sensitive to be tested. So I just wanted to mention that too, that those test kits are available at Health and Human Services.
Now, if you end up with a waterborne illness, what are some of the treatments?
Believe they give antibiotic. I'm not 100% sure on which ones. I mean, I think it's just kind of depends on what the parasites are. But I believe they will usually give antibiotic. With some other enteric illnesses like Campylobacter, sometimes they won't give antibiotic because your body can believe it can fight that off naturally. Don't quote me on that, but I'm not looking at the guidelines right now in front of me, but I believe with enterics it's a antibiotic treatment.
So you said it takes like 2 weeks?
Yeah, the range is always kind of like 2 days to 2 weeks, so it makes it challenging to kind of pinpoint exactly where you may have been exposed to those parasites, but I think it's up to 2 weeks. So when we ask questions, when we do our interviews and call patients, then we would ask, in the last 2 weeks, did you go swimming in a natural body of water? What's your source of water to your home? Is it municipal? Is it a private well? Those might be some things that we would ask. So yeah, it does make it challenging to pinpoint, but if you had, let's say we had, maybe 10 cases all of a sudden in the 2 week time frame, and they all pinpoint one similar exposure source, then we could tailor some interventions around prevention around that. So yeah, that's kind of some of the rationale for our follow-up on these type of cases.
When somebody reports that they have this illness and that they've been in a natural body of water, do you test it then? Or?
We wouldn't, no. That would probably be more of like a state level decision. Our reporting goes to the state, and then I think that's kind of up to those state level epidemiologists if they wanted to, take some type of or do some type of intervention with that. In the healthcare facilities, there's certain reportable conditions, and all of these enteric illnesses or these recreational water illnesses would be reportable to the health department. So the healthcare facilities send or notify us of those cases via the Wisconsin Electronic Disease Surveillance System, or we call it WEDS for short. That's how we monitor all these cases within the county.
Well, I suppose, too, if the state monitors it and you say you had 2 people who were ill from, say, the Pine, and then they get somebody from Madison who had been in the Pine, or somebody from Southeast Illinois who had been in the Pine, then they know to check the Pine.
Yeah, I think the kind of famous example when I was in school for public health is the cholera outbreak, and I don't remember what European city it was, but it was a water pump that the community all used, and it's the first, I think, documented example of epidemiology and public health, and they basically pinpointed all these cases of cholera to using this one community water pump. And at that time, I think it was the 1800s, they believed that it was passed through the air, and they actually pinpointed it to this one water source. So that's kind of one of those first examples of epidemiology.
Interesting. So what are some of is there any way to prevent, to be able to swim in a natural body of water? And
I would say just not swallowing the water if possible. I know it's tricky if you're, let's say you're jumping off the footbridge, which I see people do sometimes. It's just trying to make sure you don't take any water into your system. I think it's hard to say, you just shouldn't be in those bodies of water, but I think making sure you're not in them after rainfall, and then just not swallowing the water, I think would be kind of the biggest, the main 2 prevention tips for that.
Well, a lot of times this time of year, if you're not in the water, you're out in the woods hiking, and there's some issues there too, isn't there? Not that we want to put fear into people and say, don't do this, but if you're going to do this, take precautions.
For sure. I think that's the big thing is there's ways to prevent all of these things. And the big thing with, hiking in the woods and all that stuff is the tick-borne illnesses. So I just wanted to briefly touch on tick bite prevention. I know I talked about this last time I was on in April. That was sort of leading into the tick season. Now that we're kind of well underway, you probably already know some of these, but these are just some tick bite prevention tips. So performing tick checks is one of the most effective tick bite prevention practices. Tick checks are essentially just checking over your body after you've been outdoors, especially if you've been in a tick environment. It's important to check your pets too, and they can transport those ticks into your home. Some animals have a tick preventative medication, and those ticks won't embed into your animal, but they could be in their fur, and then once they're inside your house or in contact with you, then they could bite you. Important to use repellent as well. It's great for not only ticks but also mosquitoes. And some people will treat their clothing with a chemical called permethrin, which can also be a great deterrent for ticks. The last 2 tips here, one of those is just shower after being outdoors. So even if you tick check and happen to miss one, you can utilize your shower to sort of rid yourself of any ticks that you may have missed. And then wearing the right outdoor clothing is important too. Tucking your pants into your socks, your shirt into your pants. If you know you're going to be going deep into the woods, wearing long sleeves and long pants is beneficial. My brother and I were up in Winona, Minnesota, playing disc golf, and this is an example of I should have tucked my shirt in. We were definitely in tick environments, and I was wiping some sweat off my eyes, and I looked down in my shirt, and I could see a tick crawling up underneath my shirt. And, if I didn't wipe my face, wipe the sweat, I probably would have had that tick embedded because it was, right up underneath my shirt. So kind of just an anecdote or example of, tucking your clothing in can can prevent those ticks from making that direct contact with your skin. So if you want some education materials around tick bite prevention, you can reach me at Health and Human Services. Just ask for Evan. I have some tick removal kits available still. And then we have just like informational bookmarks and brochures and tick safety guides, all kinds of stuff. So if you're interested in that, or if you have staff that are outdoors as part of your work or something like that, we can distribute those to you as well.
Another thing you should check too is your scalp, isn't it?
Yeah, so scalp, like behind your ears, behind like the back of your knees, your groin area, like your waistband. I don't know if I said armpits already. That's another one. A lot of those kind of hard to see or hard to reach places. Your back, I think, is another one that, people, like, you can check your front and even the back of your legs while you're outside, but you might want to have somebody help look over your back as well.
I know before I moved up here, my parents would bring the kids up for a weekend, and my mom always said that they reminded her of monkeys on the 4-hour ride home because they were always checking each other's scalp to see if they had any ticks.
Yeah, it's a good practice to do. Obviously, you don't want to be, overly paranoid, but I think the tick-borne illnesses can be quite serious. If you have something like anaplasmosis, that can give you like 104-degree fever. So definitely important to look for those things, but I think those preventative tips can be built into your your outdoor recreation lifestyle, that you just build it into your habit, like you do a tick check before you get in the car and then shower when you get home. And I think doing those things can prevent most of it, I would say.
And what's the best way, if you do find a tick embedded, what's the best way to get it out? If
you have a needle nose tweezers, I don't know if that's a thing, but like the really narrow, small tweezers, you want to get as close to your skin as possible and pinch the tick, as close to the skin as possible, and then remove kind of straight out with a steady, strong pull. You don't want to twist, or you don't want to use those old school methods like flame or like petroleum jelly, those kind of things. You just want to remove the tick as quickly as possible. If you don't have tweezers, you could grab a tissue and just pinch it with your nails as close to the skin as possible and try to remove it.
Now, what happens if the head breaks off? I've heard of people saying that the head broke off.
Yeah, that's it's not ideal, but I don't think that it increases your chance of contracting a tick-borne illness. I think the worry would be that it would cause like an infection in your skin, like just a general infection. But I think that you don't want trying to be cautious of making sure you get all of the tick to sort of slow you down in that process of removing it. You just want to try to remove that tick as soon as possible. The longer that the tick's embedded in your skin, the greater the chance of contracting those tick-borne illnesses.
I think the greatest message here is don't be afraid to go out. Enjoy the outdoors. Just take precautions.
Exactly. Yep. And I love the outdoors, and I think working this job, you're maybe a little bit more heightened awareness of all these different things to be kind of concerned or looking after, not so much worried about, but it shouldn't deter you from going out. Just take those precautions, and you can still enjoy the outdoors and prevent those illnesses as well.
Well, we still have a few minutes here. You also work with the CHIP program.
Yep. So Richland County, the Health and Human Services, our public health unit, is responsible for implementing the Richland County Community Health Improvement Plan. And our two priority areas are mental health and substance misuse. So, we've partnered up with Partners for Prevention Coalition to work in addressing adult binge drinking, specifically focused on event safety. So if you offer an event in Richland County, you've likely received the event safety toolkit from Partners for Prevention, but implementing those best practices for event safety regarding alcohol, like utilizing wristbands, providing fencing for alcohol consumption, and then signage for checking IDs. Implementing all those things can help ensure that youth underage are not consuming alcohol. And then we also want to make sure we're not over-serving adults too, and to try to prevent that adult binge drinking. So all those things together can help ensure event safety regarding alcohol. So that's kind of our main focus with substance misuse. With mental health, we're working to reduce mental health stigma and improve access to mental health services within Richland County. So we've been trying to work with businesses and organizations in the county to provide them with resources for mental health, so they can in turn provide those to their employees and try to reach a large number of residents. We do share information at community events as well through resource tables, that kind of thing. We're in the process right now of planning a community offering of the Make It Okay presentation, which has really helped, or it's aimed to help attendees learn more about the impact that stigma has in preventing people from seeking support. Stigma is that negative set of unfair beliefs that a society or group of people have about something, and in this case, it would be mental health. So some of that is displayed in, labeling people as crazy or, psycho if they're going through like a mental health challenge or issue. And because of that negative view that society may have, or we suspect society may have, then perhaps people who need services become reluctant to seek them out. So our hope is to really work with employers and other people in Richland County to try to shift that culture and make it okay and normal to discuss mental health challenges. So if you're listening and you want to get involved in this work or offer that presentation to your staff, you can contact me at Richland County Health and Human Services, and I'd be happy to try to coordinate that with you to offer that to your staff. And then if you're interested in that community offering, just keep your eyes out. We'll have some promotional stuff going out for that probably within the next month.
And all of this is to create a healthy community, isn't it?
Correct. Yep. The community health improvement plan is completely designed based on the responses that we received from community members in our community health assessment. So we're using real data from the community to guide and instruct our interventions that we're doing. So mental health and substance misuse were identified as the two main kind of health concerns from residents. So that's what we're doing, is trying to address those.
So if someone has a question about anything that we talked about this morning, how can they reach you?
So they could reach me at, if you just call I'll just give my office number is 608-649-5965. Otherwise, you could just call the Richland County Health and Human Services and ask for Evan in Public Health, and I'd be happy to help you out there.
All right. Well, it was great having you on this morning.
Yeah, thanks for having me, Joy.
And you'll be back next month with a whole new list of topics, won't you?
Yeah, I think October is the next time I'll be in. So we'll be talking respiratory virus prevention around that time, I bet.
Well, I'll have to look. I just wasn't sure when it was. I just knew you were coming in.
Yep.
When you just fill in for the guy who's gone right now, you just kind of take it day by day.
Very good.
Well, thank you very much.
Thanks,
and again,
Joanne,
if anyone has questions, you can call Evan Ewing at Public Health in Richland County.